Hello, everyone. Well, the way learning to dance takes one step at a time, the same way quality of life takes one bite at a time. We are going to be talking with the registered dietitian, Ricci-Lee Hotz. She calls herself a dancing dietitian. So we're going to find out what that means in a minute. But we are talking about eating disorders today. So I know I have eating disorders because I love to eat chocolates and and get all messed up. But welcome, Ricky, and thank you so much for joining us today and talking about a very sensitive topic on eating disorders.
Yes, absolutely. Thank you so much for having me. It's such an important topic. I wanted to give you a little bit of a background about myself. My name is Lee Hotz, as you said. I am a registered dietitian, and I call myself Denver's dancing dietitian because I am a professional competitive ballroom dancer as well as a registered dietitian. So for me, I'm in that competitive athletic world. I understand the challenges that are exposed to so many people in terms of body image and all of those things that really can play a role in how our body relates to its need to use food as well as our mindset around food. So that's something that I find connects me very closely with so many of my patients, especially when we go to work on something like eating disorders.
Sure, and eating disorders, right? A lot of young women, I should say, that are kind of obsessed with body image, right?
Mhm.
Teenagers, especially, when they're growing up, and there's a whole pressure of dating and all those things that come into play. So, eating disorders, in your opinion, is there like a certain age group that
Mhm.
that is more prevalent than the others? That's number one. And then,
Mhm.
what is the reason for that?
Yeah, so eating disorders are very wide ranged and widespread. So they can affect men, they can affect women. You tend to see a higher prevalence in women, but men are affected as well. And with eating disorders specifically, while a lot of the time you'll see them develop in that early teenage age range, if not sometimes even a little bit before and through those teenage years, many people are affected depending on the specific eating disorder throughout the course of their entire life.
Mhm.
So, I've worked with people that are 13 with an eating disorder, and I've worked with people in their 60s that have some degree of an eating disorder. So it can be throughout that range. And there's a lot of different triggers and causes for eating disorders. So while many of us assume it's just a desire to be thin, that
Mhm.
leads to an eating disorder, while that can be one cause, there's also multiple other causes. So, for example, if someone's experienced a significant trauma in their life, that
Mhm.
can trigger an eating disorder behavior. Or if they have a situation where they feel like they just don't have a whole lot of control in their lives
Mhm.
and food is the only thing they can control, that can
Mhm.
also lead to an eating disorder. And there's a type of eating disorder that is not even so much around the mental health side, but
Mhm.
has a little bit more about I just have trouble with certain textures or things
Mhm.
like that, where it ends up making them more avoidant or restrictive around certain foods without the body image goal in mind.
Sure, and we all are kind of experienced. I mean, in the sense, like, oh, my mood is down. Oh, I had a bad day today. Oh, let me just grab a piece of chocolate, or let me do this, or make me feel better, or a tub of ice cream. We all have some degree of eating disorder or relationship, and we feel that food will help us. The relationship with our food that will help our moods, right?
Absolutely. Yes. So there are, like I said, there's a range of different eating disorders. Some are focused on restricting our food, some are focused on where we can't control how much we eat. That tends to be a lot of what a lot of us experience.
Mhm.
And sometimes it's somewhere in the middle, or there's, the purging type eating disorders where we're trying to get rid of the things we eat. And so when we're on one side or the other,
Mhm.
there's this very fine line between what is diagnosed as an eating disorder and
Mhm.
then disordered eating behaviors. And so those are a little bit on either side. So some of us have a bit of those disordered eating behaviors where occasionally a bad day leads us to, have that tub of ice cream. Whereas other people, that is happening more often than it is not happening. And that's something that can transition the behavior from disordered to
Mhm.
an eating disorder.
I see. So we have a question. Someone's asking,
Yeah.
similar to what you're saying. They're saying, what exactly eating disorder is? Eating huge amount or nothing, like you just
Yeah.
explained. Right?
Definitely. So eating disorders, I'll list a few of the different types of eating
Yeah.
disorders that are available or that
Mhm.
are, found in our society these
Mhm.
days. And
Mhm.
there's anorexia nervosa, which that is basically just restrictive eating. So you restrict your calories as much as possible.
Mhm.
Then there's um let's see, there's binge eating disorder,
Yeah.
and that is where we can't control how much we're eating. We just overeat and we feel like we can't stop.
Mhm.
There's also bulimia, and that is where if we do overeat,
Yeah.
then you use some sort of a substance or vomiting to get rid of the food.
Oh my God. Yeah.
Then there's another type called orthorexia, which
Mhm.
is focused on basically people that are so overly obsessed with healthy eating
Mhm.
that they restrict more foods than they should from their diet that can cause some health problems and deficiencies, and that it creates fears around certain foods. And then there's the one I had mentioned before that's more like textural based, or
Mhm.
uh, just having some trouble with how certain foods taste or feel. That's
Yeah.
called ARFID, which is avoidant restrictive food disorder. So, and there's even more. So that's just a set of them, but
Mhm.
eating disorders can range across the spectrum. And
Mhm.
basically, the common theme is a disordered relationship with food in one way or the other.
Wow. Okay. So
Yeah.
now that and how someone develops it? I mean, it's just like is it mental or is it just like just starts happening over time? I'm just
Yeah.
curious.
So it's very different, like I said, for everyone. A
Yeah.
lot of the time, there's some degree of an exposure to what eating disorders are, or
Mhm.
that thought process of, oh, well, I saw this ad on
Mhm.
social media
Mhm.
and they were talking about how you can lose weight. So I am going to try that. And then it becomes further and further into it.
Mhm.
Then other people, especially for like a binge eating disorder,
Yeah.
it's, one day I started and I couldn't stop. And
Mhm.
then it just keeps happening, or they feel
Mhm.
guilty about it. And so then
Mhm.
they start to maybe restrict their food during the day, which then leads
Mhm.
them to binge eat later in the day.
Yeah.
And so, like I said, or there's even just that traumatic experience that occurs and someone's
Mhm.
trying to look for some sort of a way to regain
Yeah.
control in their lives,
Yeah.
and food is that one thing that they have some degree of control over.
Sure, because food doesn't talk back to you, right? I mean, if you talk to a person going to talk back. The food doesn't
Mhm.
talk back, right?
Exactly.
Think about the psychology.
Mhm.
We're coming to now the treatment part of it, and this is not a medical advice. This is not a diet advice, guys. This is a serious disorder. We just want to
Mhm.
get an overview of what happens. What is the
Yes.
toolkit? What is the protocol?
Absolutely. So it varies depending on when the individual is seeking help. So
Mm-hmm.
say, you're just starting to develop some of these behaviors and you're noticing it's becoming a problem. You can work with an outpatient dietitian like myself,
Yeah.
as well as always recommend having an outpatient therapist available as well that is specifically focused on eating disorders.
Okay.
So a dietitian focused on eating disorders and a therapist that's focused on eating disorders,
Mm-hmm.
because it's a very specified field. And
Yeah.
so sometimes if you go to a general dietitian or a general therapist, they may not be able to give you the help you need.
Mm-hmm.
From there, say that's not enough
Mm-hmm.
and things are getting worse,
Mm-hmm.
or you've gotten to a point where you're experiencing significant health problems because of
Mm-hmm.
the disordered behaviors you're engaging in. There are treatment programs, very
Mm-hmm.
much like there are for alcohol and substance abuse. They
Yeah.
have treatment programs that have medical doctors,
Mm-hmm.
dietitians, therapists, group support, and
Mm-hmm.
have a full situation where you're immersed in the care to really
Mm-hmm.
get yourself to a point where you can get back on track. And then
Mm-hmm.
you can follow up with outpatient treatment afterwards to keep you accountable and kind of keep you following the things that you need to stay healthy.
Sure. So when you take on a client, then you obviously guide them on the diet part of it. Then at the same time, you're recommending to get a therapist because it's mental, right? It's
Yep,
everything is mental when I want to eat, when I don't want to eat. So these two things go hand in hand to
exactly.
help people, right?
Yes. And so that's, if I'm just working with a client on general healthy eating, they
Mhm.
likely don't need that therapist component
Yeah.
in the picture, because I can work on a lot of those behavior changes with the
Mhm.
individual.
Mhm.
But when it's to the level of an eating disorder, which can be classified as a mental health challenge, that's something where, well, I can help with some of those behaviors.
Yeah.
A therapist is really going to help dig into where are those behaviors coming from? Where is that baseline that's causing you to
Mhm.
feel and think that way around food so that we can work
Mhm.
through that and alleviate that? So I'm going to really help on the food side and make
Yeah.
sure that we feel like, okay, we can eat the things we need, feel satisfied, not feel guilty.
Mhm.
And then the therapist is going to work on, okay, well, where are all of these challenges coming from?
Sure. And then, in your opinion, how much time does it take for just a normal client who's
Yeah.
suffering from eating disorder to come back to some kind of a normalcy?
So if they're coming in mild, so say
Mhm.
they haven't gotten to a point where they're in a very dangerous state, or
Mhm.
they haven't been engaging in the behaviors for years and years and years, I would say normally it can take anywhere from 6 months to a year to get to a point where people are really feeling like I've got a grasp on this,
Mhm.
and they feel like I can handle this on my own and maybe check in once in a while. Um, but that being said, some individuals need that support for years and years just because it's something that is so ingrained in their minds
Mhm.
that combating those thoughts takes time. If they go into more of an intensive program like a treatment center, that
Yeah.
can normally be somewhere between 2 months to 3 months that they're in that intensive setting.
Sure, sure. And then I want people to understand if they don't take care of this, right? The eating
Mhm.
disorder, whatever someone has, what kind of medical conditions that you can
Yeah.
experience as a result of not paying attention to it, right?
Yes. So there's a few things depending on what types of eating
Yeah.
disorders we're experiencing, but
Mhm.
if we're on a restrictive side of things, the things that
Mhm.
we can experience are hair loss,
Mm.
sensitivity to cold. You can have muscle wasting. So you'll
Mhm.
see in a lot of patients that are really restricting their food, like the temples will start to
Mhm.
be really, indented, and you'll see the collarbones sticking out a lot more than they would have previously, or your cheeks will start protruding more.
Mhm.
Um, then you can experience lightheadedness, weakness, passing out. The
Mhm.
worst thing that you can experience is it can cause damage to your heart and
Mhm.
result in heart attacks and those types of issues that are more serious and can result in death. So
Yeah.
it is a really serious concern. If you experience purging behaviors,
Mhm.
then some of those problems are, if you're vomiting, you can cause damage to your esophagus and your teeth.
Mhm.
You can cause electrolyte imbalances, which again can hurt your heart, as well as multiple other things.
Mhm.
Then if you go to more toward just the binge eating side, then you
Mhm.
can put yourself at certain risks of, developing heart disease, high blood pressure,
Mhm.
and some of those more longer term medical conditions.
Sure. So, what would you tell the viewers, who are experiencing eating disorders? What is the first step? What are the next steps they should take?
Absolutely. So, reaching out for help is the first step. Really
Mhm.
thinking about, am I ready to take the step to make a change and understand that while
Mhm.
this is something that in my mind I feel like is helping me in some way,
Yeah.
knowing that it can cause my body a lot of risks. And
Mhm.
so can I reach out to an eating disorder dietitian or a therapist and just talk to them once or twice and see, okay, am I ready to get this help? And I think that's a really great place to start, because a lot of the times it's hard to tell our friends or our family members because we feel like we don't want them to know. So sometimes just being able to reach out to a dietitian or a therapist that is specialized in eating disorders is a really good first step.
Sure. Well, thank you so much, Ricky, for being with us, for
Yeah,
introducing this such a sensitive topic to a lot of people and telling them what to do as a first step and what it means, right?
absolutely. Yes. And it's such an important thing to be aware of and know that an eating disorder is not just always I just want to be more thin. There's so many other aspects to eating disorders. So if you feel like you have a truly poor relationship with food, or you
Mhm.
feel like you're thinking about food for more than maybe 15% of the time throughout the course of the day, then
Mhm.
it's something to maybe explore and see if you can get some assistance.
Sure. And there's no shame about it, like realization of if something is not right, whether it's your mental health or physical health, there's no shame about it. Just seek help, right?
Absolutely.
Yeah.
Absolutely.
Yeah. All right. So someone said, thank you. It's really important to be noticed. Yes, absolutely. So someone just making a comment. Any other
Yeah.
comments? People are watching, like I said, just come out and be open about whatever is happening in your body, and it's okay. And talk to us, and we can help you as well. With that, thank you so much for listening to our session. Thank you, Ricky, for really talking about the sensitive topic.
Absolutely. Thanks for having me.